Welcome to the Teach You Everything podcast. Today we will talk about hantavirus. Hantavirus is a zoonotic virus transmitted primarily by inhalation of aerosolized rodent excreta, causing two main syndromes in humans: hemorrhagic fever with renal syndrome and hantavirus cardiopulmonary syndrome. Hemorrhagic fever with renal syndrome, abbreviated HFRS, is mostly associated with Old World hantaviruses originating from Asia and Europe. Hantavirus cardiopulmonary syndrome, abbreviated HCPS or HPS, is mostly associated with New World hantaviruses from the Americas. Both syndromes can be severe or fatal. Human-to-human transmission is exceedingly rare and has been documented almost exclusively with Andes virus in South America. Management relies on supportive care, specifically ventilatory and hemodynamic support, as no approved antiviral therapy or vaccine is currently available in Europe or the Americas. Hantaviruses are globally distributed, with each viral species associated with a specific rodent reservoir. Infection follows one of three routes: inhalation of contaminated aerosols from rodent excreta, direct contact with rodent fluids, or rarely, rodent bites. Outbreaks may follow environmental changes that increase rodent populations or that bring humans into closer contact with those rodent populations. Old World hantaviruses cause HFRS, which presents as a febrile illness accompanied by acute kidney injury and hemorrhage. New World hantaviruses, the most clinically prominent being C. nombre virus and Andes virus, cause HPS or HCPS. The clinical course of HPS/HCPS begins with a prodrome of fever, myalgia, and gastrointestinal symptoms, followed by sudden and often life-threatening non-cardiogenic pulmonary edema and shock. Hantavirus infection should be suspected in any patient with a history of endemic exposure, presenting with acute febrile illness and thrombocytopenia, proteinuria in HFRS, or unexplained pulmonary edema in HPS-HCPS. Diagnosis relies on serology, specifically detection of IgM and IgG antibodies, as well as polymerase chain reaction testing, and characteristic findings on the complete blood count and peripheral blood smear. Those peripheral smear findings include immunoblastosis, a granulocytic left shift, and thrombocytopenia. No antiviral agent has demonstrated consistent efficacy against hantavirus infection. The mainstay of management is supportive intensive care, encompassing optimization of oxygenation, mechanical ventilation, careful volume management, and, in cases of refractory shock or hypoxemia, extracorporeal membrane oxygenation known as ECMO. The primary preventive strategy is avoidance of rodent exposure, combined with implementation of environmental hygiene measures designed to reduce rodent-human interactions. Inactivated vaccines have been developed and used in parts of Asia, but clear evidence of their efficacy is lacking. No vaccine is available in other regions. Case fatality rates for HPS/HPS range from 30 to 40%.